Unless you've been living in a cave somewhere, you've likely heard the term GLP-1 before. GLP-1 stands for glucagon-like peptide 1 and can be defined as the hormone your body makes that helps you know when you're hungry and when you're full. It also helps regulate blood sugar spikes and keeps the digestive system working properly, among a lot of other important things. The reason why GLP-1 is all over the news right now is because GLP-1 medications have just recently become mainstream and are being prescribed by doctors to help their patients lose weight. What was once only used to help manage conditions like diabetes and cardiovascular disease is now claimed to be one of the most effective and buzz-building weight loss drugs on the market. With the general public becoming more and more aware of these drugs, demand as well as cost have been skyrocketing. Americans without insurance can expect to pay well over $1,000 for 1 month's worth of GLP-1s. I'm guessing you don't have that kind of money sitting around. I mean, I certainly don't. The good news is that if you want to start GLP-1 medications and are eligible for Medicare Part D, you might be able to get that $1,000 average price tag slashed to only $50 instead. Introducing the Medicare GLP-1 Bridge. The Medicare GLP-1 Bridge is a temporary program instituted by the Centers for Medicare and Medicaid Services, otherwise known as CMS, and is meant to be a financially assisted test run for certain GLP-1 drugs. The program will start July 1st, 2026 and go until December 31st, 2027. If this program has piqued your interest, here's what you need to know. The Medicare GLP-1 Bridge covers only 3 specific medications. They are Wegovy, the injectable pens and tablets, Zepbound, but only the quick pen formulation, and Foundayo, an oral GLP-1 pill. In order to be eligible, you must be 18 or older and enrolled in a standalone Part D or a Medicare Advantage plan that covers prescriptions. You must also have a BMI of 35 or higher, a BMI of 30 or higher, plus a condition that is made more serious by your weight, like hypertension, heart failure, or diabetes, or a BMI of 27 or higher with other concerning health markers, like a history of heart attack or stroke, a pre-diabetes diagnosis, or peripheral artery disease. Eligible members will pay a $50 flat copay. No more, no less. Keep in mind that Bridge is being provided outside of the Part D benefit coverage flow, so copays will not count towards meeting your Medicare Part D deductible or your max out-of-pocket. That $50 copay will also not count towards troop costs. Additionally, no low-income subsidy or LIS will be given for LIS beneficiaries. That $50 copay amount is absolute. And lastly, you must be approved for the program by your doctor. They will fill out the necessary paperwork and coordinate with CMS on your behalf, and if you're cleared, you'll be able to pick up your medication at your preferred pharmacy. Just remember, this is a pilot program. Coverage for these drugs may not extend beyond December 31st of 2027. If you'd like to read more about Medicare's GLP-1 Bridge program, I encourage you to check out CMS's official guidelines on their website, cms.gov. And that's it for today, folks. As always, if you have an insurance question you need answered, leave it in the comments below and it may be the topic of our next video. We'll see you in the next one. Bye.